Regarding blood pressure medication and blood pressure itself, I always begin, of course, with the baseline measurement. And are we happy with that baseline measurement? Is any action needed right at the beginning? Is the blood pressure very high, or sometimes it's surprisingly low? The next thing to add in is what are the patient's hopes around their medication? So often, if you ask that question, they'll say, I'd quite like to get off some of my medication. And then you might say, well, you're on several. Is there any particular drug that you'd like to come off? Funnily enough, a patient addressed this very question only a few days earlier in the week. And this was a patient who said, I'm pretty certain amlodipine is giving me ankle swelling and pain. So for her, one of her main motivators was to come off amlodipine. And that's great, because that was my motivation as well. So that you're blending patient safety, the blood pressure as it is now, the patient's hopes, and then you may have some things of your own. If the patient is on diuretics, for instance, you know that bendrofluozide may well be affecting the blood sugar, so that for you might be a priority to get patients off that particular drug. And then I suppose the next thing is explaining to patients what they might expect. So if they've signed up to this seriously and they lose weight, you would hope that their blood pressure is going to improve. And again, you would couch this or frame it in terms of an improvement rather than a risk. I suppose there is a risk that they'll stand up, feel dizzy and fall over, but actually that doesn't happen very often. It's more, this is more of an opportunity. And so I'm always pleased if a patient is interested in monitoring their own blood pressure. That gives me far more information as a basis for decision making in the future. But also it gives patients feedback. So they're always coming in with lists of blood pressure that they've taken themselves, and the blood pressure is improving. So that is great feedback for your patient when they've taken the blood pressure and they know it's improving. Plus, if you've explained to them that they might feel dizzy at times if their blood pressure drops, and that might be an opportunity to reduce medication, they'll then make an appointment early and sort this out with you, because their expectations are appropriately set. As I pointed out already, there are some medications that are of particular interest, and I'd come back again to diuretics because of the side effects of gout and the worsening of renal function that can be experienced, and also the fact they are diabetogenic. A particular word on amlodipine. I've come across so many times where a patient has swollen ankles as a side effect of their amlodipine, and then as a tragedy, they've been put on diuretics to treat the ankle swelling that really originated in the amlodipine. So it's worth keeping an eye open for anybody with swollen ankles who's on amlodipine, because that might be the cause, and you might solve it so easily with some weight loss. So there we are. It's establish a baseline. Are you happy with it? Is the patient happy with it? What are the patient's goals as regards their own medication? Have they any worries or concerns? And then what are your goals with the medications? Have you got any worries or concerns or things you'd like to change, so that between you can come up with a plan encompassing your shared hopes for this, and point out if they lose weight, it is so likely the blood pressure is going to improve. That's what you can expect. So thinking about my own clinical experience around blood pressure, I'm getting average drops in the systolic, something like 10 millimeters of mercury is quite common, and the diastolic doesn't drop quite as much, maybe 7, something like that. It drops, I'd say, fastest in some of the heavier patients who get initially very great weight losses, and they're worth watching particularly. The blood pressure, I find, usually plateaus out in the first year, somewhere like that, and then stays pretty constant. I haven't had any surprises later on. So you're going to get your greatest improvements probably in the first few months. And it's that time when it's worth doing those blood pressures a bit more often and alerting the patients to what they might expect. So this blood pressure control is a great aspect of the low carb diet, really.